rush hour has changed. Gone are the queues and carriages to yourself. As the nation limps out of lockdown, today the Prime Minister said he wants to speed that process up.
If we can be confident that the places of work are COVID secure, which I'm sure we can, then employers working with their employees should be encouraging people to get back to work where that is right for that employee. That's what we're saying.
So back to our places of work, and after months of being told to avoid it, in England, back onto public transport too.
We are making clear that anybody may use public transport, while of course encouraging people to consider alternative means of transport where they are available.
Only 1 in 3 of the desks can be used.
COVID-proofing the workplace isn't always that easy or cheap.
What people do is that for each day they're in, they're allocated a desk. They scan the QR codes that have been put on all the desks. You then register, and that means that if you do develop coronavirus or you do develop symptoms, they know where you sat, who you sat near.
The cost is worth it, says Neil Bennett. Since June, staff have slowly started returning to the office and revenues have started creeping up.
It was an announcement slightly thin on detail. As an employer responsible for hundreds and hundreds of staff, are you concerned about that lack of detail?
Of course, but it's a step in the right direction. You know, until this morning, there was complete vagueness. It was, well, you know, stay at home if you can, but maybe you shouldn't. And I was getting increasingly frustrated that there was really no guidance. At least there's a general sense of direction now and a clear sense of direction. And as I say, I like the fact that Boris Johnson is treating employers as adults and saying you have to have an element of discretion.
I got the feeling the Prime Minister was passing the buck today to employers, whereas what we need to hear is what are you supposed to do if you're shielding or you've got kids or issues about public transport? Will people get sick pay when they need to take time off work?
For most of us, if you're working from home, you're just not spending as much as when you're normally heading to your place of work. You're not buying a cup of coffee on the way in, you're not popping out for a sandwich at lunch, you're probably not adding to your wardrobe as often with new clothes. And all of that extra spending is desperately needed by the UK finances right now. But that's leading some to question, is the health of the nation being traded off against the health of the economy?
For months now, the government has had a single mantra for how decisions have been made.
We are being guided by the science.
And we will be guided by the science.
Guided by the science.
Guided by the science.
Obviously, we'll be guided by the scientific evidence.
Today, though, a nuanced shift.
In the end, decisions are taken by the elected politicians. We have to weigh the advice that we get.
A shift away from the chief scientific advisor who just yesterday said this.
Distancing measures are important, and of the various distancing measures, working from home for many companies remains a perfectly good option. Absolutely no reason I can see to change it.
The government said more guidance will be published on the 1st of August. That will be details for the employers. The broad brush for the employees is get ready to get back to work.
Well, the Prime Minister also said local authorities in England would be given new powers to enforce restrictions to control outbreaks in their areas. Today, Rochdale introduced a series of measures similar to those which Blackburn brought in earlier this week to try and avoid a local lockdown. Our North of England correspondent Claire Fallon is there. Claire.
Well, according to data that's been published this afternoon, Rochdale is one of a dozen or so places in England where there are real concerns about the spread of COVID-19. Here, they are saying that there is still a gap between the number of cases here and in Leicester in recent weeks, but they are concerned enough that they've brought in new measures as of today. So essentially, they're saying to people, don't wait for the law to change on face coverings. Do that now when you're in shops, when you're in other enclosed places where it's hard to socially distance. Also, people being told to limit the number of visitors into their homes. And all of this comes on the same day that we've been told local councils will be given new powers as of tomorrow so they can close down shops or businesses or stop events happening if it's deemed as being necessary to prevent the spread of COVID-19. Although I should say that having looked through the legislation, it is clear the Secretary of State retains overall control, because Matt Hancock will essentially be able to overrule local decision makers on this. And when I spoke to the leader of Rochdale Council earlier today, after the announcement had been made, he was telling me they still weren't entirely clear on the details of this.
Well, I haven't officially heard about it because I've been out and about most of the day. You've told me about it. 1 or 2 other people have told me about it. I've checked with our people today. There's not a lot of detail, but I welcome the news in one respect. We've always said from the beginning that if we'd have local people and have had the local powers, we perhaps wouldn't have had some of the problems.
Of course, for councils to be able to use these powers effectively, they need to know where cases are happening. And even though central government says local councils are now getting all of the data, the Local Government Association today has said that there is still a gap of granular level data that local councils are not getting.
Now, from August the 1st in England, you'll be able to go to a bowling alley, a casino, get your eyebrows done and go to an indoor theatre performance, the latest steps in Boris Johnson's COVID recovery plan. But the government's chief scientist and scientific advisor have given a far more pessimistic assessment, warning it's highly likely that another wave of the virus will return later this year. Aisha Tull reports.
Suspended in time. With pins frozen in place, empty lanes and not a strike in sight, this bowling alley and karaoke spot in East London got the news they've been waiting for today.
Elated. We've been so ready. The team have been working so hard to get these venues up and ready. We've added some safety measures such as individual screening on the lanes. In addition, every single party get their own balls now, so they get a set of balls that get changed and sanitised between guests. We've relaxed our shoe policy. We do have sanitised shoes available for guests, but we're very happy for them to return in anything that's a flat or a sports shoe.
Along with bowling alleys, other places to open from the 1st of August include skating rinks and casinos. Close contact services with beauticians like eyelash extensions and eyebrow threading will also be able to happen again. Come September, schools, nurseries and colleges will be open for all children and young people. By October, plans are for audiences to return to stadiums. And from November, the Prime Minister wants everything to go back to normal.
It is my strong and sincere hope that we will be able to review the outstanding restrictions and allow a more significant return to normality from November at the earliest, possibly in time for Christmas.
And while Boris Johnson seems confident the country will get back to normal, the scientific and medical advisors who usually appear alongside him at these briefings told the Lords Committee they're less optimistic.
The reality is distancing remains an important part of this mix, and how it's interpreted in different environments has evolved, but it has not gone away. So all of those need to continue for a long period of time.
By the end of the year, we could also see a new range of problems. At the moment, the sun is in the sky, there's loads of people outside, and the risks are lower. But come winter, when it's rainy and cold, and people will be inside, the risk of infection could possibly go up. And what would that mean for the NHS and the usual pressures that they face?
The government also announced today that there will be an extra £3 billion in funding for NHS England. Scotland, Wales and Northern Ireland will get additional funding too. The new money would allow the NHS to continue using additional private hospital capacity and keep the temporary Nightingale hospitals open until the end of March 2021. Even with these announcements, winter is still a big concern. The pandemic really kicked off in spring, so we don't know what a winter with COVID-19 will look like. But for places like this, they hope the changes they've made will keep COVID out so they can keep customers coming in and recover from what's been a long time without a strike.
Well, I'm joined now by Professor Stephen Reischer, a behavioural scientist and one of the experts who fed into the group that designed the lockdown guidelines in the first place. Professor, has the government been clear enough with people about whether they should go to work or whether they should work from home?
I don't think so. I think there's a lot of confusion, and I think there's confusion at two levels. I think there's a confusion over specifically what we should be doing, and so earlier this week we saw the confusion over whether you should or shouldn't wear a mask. Now there's confusion about going to work or not going to work, but I think lying above that is a larger question, which is what is the overall strategy of this government? They want it to be all over by Christmas. I want it to be all over by Christmas, but what's the strategy by which you will get there? So if you look at the figures today, for instance, today 687 new cases came about. Last Friday, it was 679. In terms of deaths, there were 114 reported today. There were 85 reported last Friday. So we have a level of infection whereby hundreds are dying every week and thousands are getting infected every week. Are we satisfied with that? And if we're not satisfied with that, how are we going to drive it down to a level where we have all but eliminated the virus and where people can feel utterly confident to go out, to enjoy themselves, to have a wonderful Christmas?
Well, is it possible that the behaviour they're trying to affect is as much about who people blame as it is about what they do with regards to COVID-19, that by having a very confusing picture, people will say, well, it's all very confusing, the science keeps changing, you can't blame the government?
I simply can't answer that question. I'm not a politician. I hope that they are acting for the public good. But you see, it seems for me that this notion that there is a trade-off between the economy and public health is to some extent misconceived. The best way to get people out and to get people spending is that people can be utterly confident they can go to work and be safe, to go on public transport and be safe, to go out and spend and be safe. And if you open prematurely, the problem is that people won't have that confidence. So the figures coming out today, for instance, were that some 40% of people aren't going out to spend money because they're concerned. So the way to reopen the economy properly is to have clear measures which will drive the level of infection down, which will make people confident to go out and spend their money. In that sense, the public health and the economic interests are aligned. And the one thing that would be truly disastrous economically is if we have to have another hard lockdown because in the winter things spike again. So we have to use the months before winter. They're only 3 months before winter. We have to use that time to drive the infection down low enough such that we don't get that second surge and we don't get many more deaths and we don't undermine the economy. This seems to me really to be a case where slow and steady wins the race, that we need to be realistic about the problems and about deficits and have a clear strategy to drive down the infections.
We have a situation right now where the chief scientist was yesterday basically saying, if it's possible to work from home without affecting productivity, it's best to work from home. And the Prime Minister is saying, if it's safe, it's best to go to work. Now, what does your history tell you about who people will believe? And do you see that there is now a clear division between SAGE and the government?
Well, if you look at the trust figures, and I was looking at the trust figures the other day, that post the Cummings affair, trust in government fell precipitously. It's now extremely low. If you look at the trust in the Prime Minister, the last time I looked, it was minus 60 points. In other words, 60% more people distrusted than trusted the Prime Minister. When you look at the highest trust figures, they're for the NHS, about 85%, and they're for scientists, about 83%. So I think the problem is that, no, there isn't trust in government, and there needs to be more trust in government because we need to be guided out of this pandemic.
Professor, thank you very much indeed for joining us.
Thank you.